Hello, my name is Dodie Callender. I am speaking to you today on chronic care management and health policy, two of the four pillars of population health. Chronic care management is driven first and foremost by the patient or client. The patient seeks treatment or interacts with the team of healthcare providers, usually in an outpatient setting. The team would include primary healthcare providers and any number of other disciplines depending on the problems the patient is having. Specialty doctors or nurse practitioners, physical or occupational therapists, nutritionists, dietitians, respiratory therapists, pharmacies, and places for diagnostic testing could all be part of the team, depending on the issue. The team offers education and solutions to the patient, but must remember that the patient is the driver and the team is the navigator. The patient must be willing and committed to the course of action, or it will not happen. The providers must remember that urging is fine, but you cannot expect the patient to agree to or stick to a plan when they are not willing. It is up to the providers to ensure access to the services, whether it be by telehealth for a doctor or deliveries of prescriptions by a pharmacy. A managed care model is needed that is proactive rather than reactive to adequately deal with chronic conditions. These conditions can be managed better if the patient has regular healthcare visits and is working to manage their condition, rather than just seeing the doctor when the condition flares. This care model should take into consideration the patient's needs, access to goods and services, anything the patient needs to manage the condition, and access to other support services such as smoking cessation. These services, combined with a safe area to exercise, availability of fresh food, and the availability of transportation, will all help ensure the patient is able to stick to the plan that was agreed on. Healthcare policy is closely tied to chronic care management in the aspect of access. Healthcare policy, such as the Affordable Care Act, is a good place to start, but it does not provide or guarantee access to the provider or services necessary. Local policies need to be implemented to guarantee access to the services. In my community, there is limited access to specialized care. We have one urgent care clinic, so when it is closed, patients use the emergency room at the small local hospital. Uninsured patients also use the emergency room as an urgent care clinic. We have one cardiologist, two podiatrists, and two ophthalmologists. The cardiologist and the ophthalmologist are in town 2 days a week. There are no labor and delivery services, and sometimes there is a pediatrician. Some healthcare groups will bring specialists to town monthly for certain services, such as neurologists. Currently, to see an orthopedic specialist, you must have transportation to Las Vegas, which is approximately 60 miles away. Communities need to have policies that give greater access to healthcare to their citizens. This could be accomplished by the health department giving specialists a space to see patients and arranging transportation for these patients to the health department offices. Increased telehealth services are a good place to start also, but if a procedure such as a steroid injection is needed, that cannot be accomplished with telehealth. Telehealth could, however, play its part. The doctor, after meeting with the patient, discussing the symptoms, could order diagnostic testing or physical therapy, as well as being prepared to give the in-office treatment at a later date when they are in town. A lot needs to be done with health policy to ensure access to all citizens, especially those in underserved and rural communities. Thank you.